Medications to treat COVID-19. People who test positive for COVID-19 and are at a higher risk of becoming very sick may benefit from available COVID-19 medications. These treatments can help prevent severe illness, hospitalization, and death from COVID-19. Talk to your healthcare provider right away if you test positive and are at a higher risk, as the medication needs to be started early to work its best. Your healthcare provider will help determine which COVID-19 medication option is best for you. COVID-19 medications are available to anyone, regardless of immigration status, and will not impact your ability to become a permanent resident. COVID-19 medications are not a substitute for prevention. Everyone who is eligible should get vaccinated and take other steps to prevent the spread of COVID-19. Getting medications for COVID-19. There are 2 ways to get COVID-19 medications if you are at higher risk of becoming very sick from COVID-19. Talk with a healthcare provider to learn if you qualify for COVID-19 medication and where to get it. Find test-to-treat locations that offer COVID-19 testing and free medication at one location. COVID-19 medications must be started within 5 to 7 days of symptoms starting to work their best. If you have symptoms, get tested. See the next sections of information on testing and where to get medication. How to get tested. Get tested and treated for COVID-19 at your healthcare provider's office. If you have a regular healthcare provider that you see, ask if you can get tested and treated at that appointment. Test with an at-home test or at another testing site, for example, a community testing site. Free at-home tests are available from the federal government at Get Free At-Home COVID-19 Tests. If you are enrolled in Medicare Part B, you can order 8 additional free at-home tests. After getting a positive test, talk to your healthcare provider or find a clinic or test-to-treat site to receive a prescription from a qualified healthcare provider. Some health systems and test-to-treat sites also have a telehealth option available. Get tested for COVID-19 at a test-to-treat location. At a test-to-treat location, you can get tested for COVID-19, and if you test positive, the on-site healthcare provider will check if you're eligible to get a prescription for COVID-19 oral antiviral pills. They will prescribe and fill the prescription in the same visit. Bring any medications or a list of medications that you're currently taking with you to your appointment. Where to find treatment medications. Online. The Minnesota Department of Health website can be looked at to find participating clinics and pharmacies across the state of Minnesota. A test-to-treat locator. You can also go online to access the federal government's test-to-treat locator. By phone. Hotlines are available to help answer your questions in English and other languages and to direct you to resources for testing and treatment. For deaf, blind, and hard of hearing people, you can use your video phone to call this number. Finding free or low-cost healthcare. People who do not have insurance may be able to find free or low-cost treatment in their communities at a federally funded healthcare center or community health center. The MDH COVID-19 public hotline can help you understand treatment and medication options, direct you to resources, and provide language assistance. They're available Monday to Friday, 9 a.m. to 7 p.m., and Saturdays, 10 a.m. to 6 p.m. The cost of COVID-19 medications. Right now, there is currently no cost for most COVID-19 medications, which means patients do not have to pay for the medication itself. Pharmacies cannot charge a fee directly to a patient for filling the prescription. But there may be other fees associated with getting the treatment that a person or an insurance company would need to pay. For example, a clinic may charge for services associated with administering a treatment. Patients may have a copay for these services depending on their insurance type. Talk to your healthcare provider or pharmacist if you have any questions about costs associated with receiving a particular medication. Coverage of treatment fees or costs. Medicare Part D covers any prescription medications that are used to treat COVID-19. Medicaid fully covers the monoclonal antibody treatments during the public health emergency. Check your insurance plan, as many large private insurance plans will cover the costs. If you do not have insurance, find free or low care costs at a federally funded clinic or community healthcare clinic in Minnesota.